All right, so I just wanted to kind of recap that video we just took on the top three causes of hip pain. Hip pain, excuse me. And the difference between the cause and the diagnosis, right? The diagnosis is the name, so things like arthritis, bursitis, labral tears, sprains, strains, those are names. Those don't help us understand the true cause. The true cause is movement. And if you look at all the different diagnoses of hip pain, when somebody's having pain in an area, it's usually because that area that's painful is moving beyond its threshold. Everything in the body has a threshold. If I take my finger and extend my finger back, it has a limit. And if I do that to its end range or beyond that end range, and I do it a lot with a lot of force, it'd be logical that my finger would start to hurt when I do that, right? So the hips are the same way. If the hip is hurting, it's not the hip's fault, but it's the movement that's occurring. Number one, it's finding the movement that causes the pain, the direction of movement, and then looking at the areas above and below the painful spot and trying to figure out if they're moving enough. And usually you'll find an area above and below in the direction the hip is hurting that's not moving enough. And what we do then is we want to first identify the patterns of motion that are not occurring properly, that are causing the hip to have pain, and then we address those movement directions in the other areas of the body. And so in the following videos coming up here, I'm going to show you how I identify the movement directions that are causing the hip to be irritated, and then the last phase will be how to improve motion in the areas above and below the hip that aren't moving enough.